Hello!
Hello.
So we are now 5 days from taking off probably 20 to 25-ish pounds or something like that.
It's crazy to me.
You have a stomach that I want now, so I actually want to do this to myself pretty soon. And even the sides came in. You know, we had those other areas, but I knew we wanted to go live because I know you've had this was a big surgery.
Yeah.
You know, as you and I started, you know, we talked about lymphedema. We're going to start slow, make sure you're okay. But as we start going up, we're taking more and more and really getting this.
Right.
And I always tell people, this is probably the game changer because this is the one that allows you now to fit into stuff better.
Yes.
Not falling over. And when you think of 15, 20 pounds just hanging off, like it's a lot. It's a lot.
I think too, it was a surgery that people that can't see results in other surgeries could see the results instantly. Like it's such a visual difference that like someone like, your lower leg's still puffy. They're like, oh, your stomach is gone. Like there was no doubting that this was like addressed, you know.
You should put a couple pillows here and then see if people notice it. No, you're sitting 90 degrees right now, or close to 90 degrees, and it's not hanging over. So you're actually going to be great. But I know you had a lot of engagement, you had a lot of questions about this, and I like explaining it anyway. I like talking about why we do stuff and how we do stuff and how you torture me. So I think we should kind of talk about that today. So.
Yeah, so one of my main questions was the surgery easier or harder than you thought? And like how long did it take?
I don't remember how long it takes. I don't even look at the clock in surgery. I don't ever leave surgery until I feel like that's the best we could ever do at that point. So I honestly don't remember that. But your surgery wound up being a lot more challenging than I thought. So I do a lot of this. I do a lot of massive weight tummy tucks. I do a lot of lipedema tummy tucks. Yours was one of the hardest in a lot of different ways. One is you almost didn't have any normal tissue even to the upper abdomen. Like it's really all lipedema, whereas most people, it's down here, so I'm pulling down regular stuff. The other thing is you're anatomically, so we know you have the hips, but you have a roll up here, you have another roll up here, which isn't your stomach. So the biggest part of your stomach was the pannus, but then up here. Most people, the stomach starts here and just goes around here. You did this, and then you did this to me. So, and it's hard for me to figure out how to get your back and your stomach and everything. So I did. I spent a lot of time on there trying to release it and get it. And actually, we brought it in a lot. But yeah, it was actually a challenge. It was actually a little bit, you definitely challenged me more. And then the worst part, which you mentioned to me now after the fact, is that you have the palest skin ever and it just turns black and blue in 2 seconds. So as I'm worried about like skin dying and healing and this and that, you're telling me that's just totally normal.
Oh yeah, I go like purple.
Yeah, I know, the sides turn purple. That's when I felt a little better when I realized this was purple, then this was, I was like, okay, we're doing okay.
Yeah.
But no, totally honest though, your surgery was more challenging than I thought it was going to be. So I never go into surgery thinking something's going to be easy, and I do a ton of it. So most of the time it's just routine. We do so much stuff. But yeah, you definitely made it a little more of a challenge. So
I knew it was all lipedema, but it even surprised me when I saw the picture of like, oh, like that was a lot of nodules.
Yeah, all the way up. So up here, what I had to do is we did liposuction, but you know that doesn't get the nodules out.
Right.
So I wound up doing a lot of manual. It's kind of cool. We have to open manual extraction, so I'm manually extracting and pulling everything out. So we got a lot out of you. But the other thing also is, you know, we did our version of tummy tuck, and that is, I was able to save your fascia. I was able to lift it. It's called scarpas, your deep fascia here. Lift it up, so that's why you're going to have a pubic lift, a little bit of a thigh lift here. It's tight as hell. It's really tight for people. Yeah.
I was like, this is in a different spot.
Yeah.
Like, this is not where it was.
It's back up where, and because we're not just, most people just tack skin to skin, and so over time, it's actually going to kind of stay there. It's really cool. I love doing that. It takes a lot of extra time for us to do that, but it's really worth it for people. So.
Is that why I kind of feel like there's a line? Okay.
There's a lot that goes in there. So inside, this gets pulled up, the skin gets pulled down. There's a lot of stitches inside too. So there's a lot of stuff here to kind of bring things down. There's a lot more that goes on than people realize. So the beginner's tummy tuck is, you raise some skin, you cut, and you just close it. Like this is way past that in so many ways. So, but I love doing it. Love doing it.
How much did you take off?
So the weight of the skin, even though I think our scale is off, weight of the skin was 15 pounds or a little more, I think. We took out over 5 liters of liposuction as well, and then all that weight doesn't even count all the manual that we use. It's a ton too. So, you're gonna get on the scale when you're less swollen, and I'll bet you're down 20 to 25 pounds. I mean, it's a lot. It's really a lot. And like holding it after, I mean, it's heavy for me just to hold. That was just one side. I mean, both sides. I mean, I don't know how you did it. I'm just being totally honest with you. The reason I love doing it is I'm sure like you feel like
my lower back, yeah.
It's just it's actually crazy. I mean, I wish everybody should do it. It's the one time where I tell people this is the right thing to do and just remove it. You're gonna do so much better. So much better.
Yeah, I tried to like explain it to like my kid as like, you know, when you put your book bag on backwards and like you feel it pulling on your back differently. Yeah. I was like, that's how it was for me 24/7.
Actually, the interesting thing, though, which we're seeing, remember, the theory is also that we're removing we're relieving pressure here. And you, after the first day or so, your feet were even less swollen, even without wearing compression. Yeah. So I think you're going to see a lot more of that to it. I'm not going to say it's curing lymphedema or anything like that, but I do think there is something with it as it's working.
Oh, my feet were the flattest I've seen them in probably 20-some years. My thighs were like empty, like without even like, because I hadn't had compression on for the first couple days. Yeah. And I was worried because I had that one spot by my left thigh that didn't want to like calm down, and I was like, this is softer than it's been. It's like, I was taking pictures and like, you know, because that's what I do. But, but I was so excited. I was like, this already just like, my saddlebags feel softer.
There's a lot more that goes into it. People don't understand. They're always looking. They're saying, "I'm here." The body's not as simple as like people make it out. Like I have some fascia, some lipedema. It's really all interconnected. And one of the reasons, actually, I'll tell you why your saddlebags feel lighter. Actually, so that fascial thing I was telling you about, the fascia is all around our body. I do it all as far as I can, and so that's even pulled up here. That's why. So it's internally. We call our internal waist trainer, which is our thing, but. Yeah, that's actually why you feel that. So for you, I come as far to the side that not only am I lifting here, I try to come as far as possible, and I'm pulling on everything we can. So I'll bet that's actually why you're feeling a little lighter there too. I didn't even think about it, so you just said it. But
because I was like, these feel really soft.
Yeah, and I love doing it. It takes us a lot extra time to do that. It's this cool thing we've been developing, but it works so well. It really does. So.
Now I know, like, with belly buttons.
Yeah.
How exactly do you get it in a new spot? Like, is it, because isn't it like a step, like, isn't it attached to something?
Well, we take it out, we throw a dart, but it looks pretty good there. Yeah. Belly button actually doesn't ever leave that spot. It's like a magic trick. So we cut around it and leave it there. It's always there. When I bring the skin over, I make another hole and bring it through.
Oh, so like a button.
Yeah, I guess. Yeah. And it's, when you do that also, so it winds up being, you can, theoretically you can place it a little bit differently, but it actually winds up being in a really nice anatomical, like it really actually it winds up being in a better spot also for most people, so. Yeah,
it's weird to me now, because like, I was like, I never saw it before. I was like.
That was probably the one thing you made easy for me. You had the one belly button, which I still can't believe.
It was super tiny.
It was really tiny. Normally, when I'm doing this, it's like this long and it's like this big, and I'm like trying to like I suture it down. I'm trying to like make it look good. That was the one thing you made easy for me. So that was the only thing. So.
How much skin? I know we talked about the weight, but was it?
So we measuring this way, it was at least 2 feet long on either side, so you're 4 feet in this way. Measuring across, I don't think we did, but you're probably 3 feet this way too, so I mean, it's a lot. It's a lot. I normally just measure, at least from here down, because I want to see. So take, 2 feet, 12 inches, 24 inches, I mean, it's...
I'm only 5 foot tall.
Yeah,
I'm only 5'2".
It's a lot.
I mean, there was like.
Yeah, you can actually. We take so much. We think that 2 feet. I can actually take it and I can flip it up, and it'll probably be up here for you. So it's a lot. It's a lot.
Yeah, like that picture of you and Jerry holding it, like it just looks heavy.
It was heavy. It actually is heavy. So.
It's just so crazy. Like, I, for one, like, I was really panicked about this surgery.
Me too.
Like,
Me too. Yep, definitely.
because, like, the other ones, by the third one, I knew what we were doing.
Yeah.
And the incisions were just a couple inches. And so, like, yeah, it was surgery, but it wasn't, like, surgery in my mind. But I knew how much I had here and what was going to have to be cut. And, like, I know I medically needed it. Like, I know I did. But when you hear tummy tuck, there's that stigma of, like, vanity to it. And, like, I'm a single mom. And so I'm, like, I'm panicking. Like, I was really, like, the night before, I was like...
It becomes a big thing. So I do, just in my practice in general, I do a lot of tummy tucks. A lot of massive weight loss, a lot of lipedema, a lot of cosmetic. It's the reason I love doing it. I do a ton of them. It's one of the things you can really affect people with, because you're also tightening muscles, tightening fascia. It actually helps a lot of anatomic things also. So that's why I love doing it. But when I'm doing it for people, it's actually not vanity. If you think about it, anybody I'm doing it for, it's either they've stretched everything out, lost a ton of weight,
Right.
They're getting rashes here. You had kids. I would say kids don't care what they do to your body even at all. But you know, it's not that. So it's not really a vanity thing. It's actually not. And so it's probably the one really cosmetic surgery that I say it's really not vanity. You know, there's nothing else you can do at that point. You know.
I think it's just, like, from when they first came out, it was like that, you know, the mommy makeover. Like, I want my boobs and my stomach better. It wasn't talked about all the other benefits for it.
Yeah.
So that's why, like, I think it sticks in, like, because a lot of people were like, do you really need it done? Like, why don't you just have them lipo? And I'm like, because there's so much skin here if you lipo.
I treat it. In fact, I'm doing surgery this week with a guy who lost, I think, over 200 pounds. I forget the whole thing. But his stomach is hanging down to here, but more importantly, even his pubic area is hanging down. It's really so. I mean, we're gonna reset that with the fashion. So it's really, it's not a vanity thing. I mean, it really helps people in a lot of different ways. So I don't ever look at it that way. So.
Right. That's, like, part of why, like, you know, I say I adore you, but, like, it's part of, like, because, like, I've never felt like it was that, like, Beverly Hills cosmetic, like, boobs are this price, legs are this price, you know, like, I felt very much like a person of, like, this is what you need done to feel better, like, this, let's fix this.
Yeah.
And, like, after having 20-some years of a doctor not believing me, like, it was such a change.
You're gonna, I mean, I'm telling you, after this, we've done a lot on the front, which you're feeling lighter and better already.
Oh, yeah.
This is gonna be crazy. I mean, you're just gonna feel so much better with this. As we start, then our next things, we start tackling the back. Like, you're gonna be. I told you from the beginning when we first met.
Yeah.
I said you're not gonna believe me. It may take a year, 2 years. You're gonna be a totally different person by the time we finish.
Yeah.
And it's not so much even the skin and stuff like that, but you see what happens, and you see that it's. You know, it's something where, you needed this. You really do.
Yeah, like, I didn't realize how much the surgeries would, like, mentally, like, change things. And it was, like, I feel peaceful now. Like, and I don't know if it's just because, like, I'm not in constant pain.
Yeah.
So, like, before it'd be like, oh, I have to do this, this, and this still for the day, but, like, I don't have the energy, or it hurts, or, like, I was already standing for an hour, so now I can't walk because my feet hurt. And so, like, to be able to, like, okay, work's done, but I still gotta run these errands and it not be an issue, like, it's just so different. Like, it's crazy.
Yeah, it is. I mean, we have, we even filmed this morning, I uploaded a lady yesterday, we took out over 8 liters, I forget what it was, and the next day today, we filmed her, and we said, tell us how you're feeling. No hiding. She said, I walked downstairs. I mean, she rented a house here that has, like, a lot of stairs, and she had thought at first she was nervous about it, and I said, I think that's good for you. So, you know, I like people moving out there.
Right.
So as she was coming here, she walked down the stairs, she goes, I'll tell you, she goes, I should be sore and stiff and stuff like that. She goes, it was easier for me to walk down the day after even, and it's just, so we see a lot of that. It really does, it really does help. It does.
I mean, that's what I said in my first surgery. I said I overstepped going to the recovery apartment because my legs were so much lighter. Like, the first surgery was overstepping. The second, my saddlebags didn't jiggle when I stepped back down. And that was weird because normally I would step and I would wait for, like, the jiggle to stop before I stepped again because otherwise it would throw off my balance. And the thighs, The thighs was easier to get like up and down off the couch
Mm-hmm.
because I have a sectional and I like to wedge in the corner,
Okay.
and it was easier to like climb back out.
Got it.
Now, this one, my lower back just feels amazing already.
Yeah.
Like, it's just crazy how already, like, it feels so much different. Is there anything that needs to be, like, precaution while recovering?
I mean, you know, I like an active recovery, so I want people
Right.
up and out and doing stuff. I make people pretty tight. Like, you know, the first few days, it's really have you hunched over, and it, as you were standing up, you can see it really, even with lipedema, with stretchy skin and everything, you can see that it really was tight for you to even do. Usually by the first, for me, it's just the healing issue and the skin and everything, because especially you had no normal underneath tissue. But no, for me, it's get back to the things you do. Walking a lot, you're gonna start exercising, it's the eating. I tell people don't starve yourself after my surgeries.
I have
Protein
been
shakes.
starving.
Yeah.
Like, every 3 hours,
Yep.
like, angry hungry.
Yep.
Like, and I'm, like, that's never been a thing for me.
Because you're so used to, if you think about it, you're so used to starving yourself, but your body's not, but you're still growing. You're getting back to normal, like, healthy things. Like, this isn't, once you start removing all this, like, you're gonna be like everybody else your age. Like, it's gonna be normal things. Your body's gonna be hungry. You're gonna be doing more, you're gonna be burning more energy, you're gonna be doing more stuff. Like, you'll see it gets.
I was complaining, I was like, complaining to my friend, she's like, that's how people are. Like, they feel hungry every few hours.
Yeah.
I was like, I don't like it. Like, I'm not used to it. Like, the other morning, 4 o'clock in the morning, I was making chicken nuggets because I was starving. I was like, I need to, like,
Keep doing it. You're not gonna gain a pound. You need it to heal, but you
Right.
really do.
and I'm afraid to do protein shakes after last surgery, so I'm eating other sources of protein. But, so there's no restrictions on, like, lifting stuff or, like, pulling my
Yeah.
suitcase, like, that kind of.
I do want you. I don't really want you doing a lot of that. So yeah,
Okay.
not a lot of lifting stuff. You don't want to use any of your core right now. So if I know you're going back tomorrow. If your suitcase is wheeling, you can
Right.
do that. I mean, I prefer you didn't. I prefer you don't lift it up. I prefer you really don't do anything. Remember, I said you're still really tight. There's a lot of stitches. You can still pull things apart and pop things
Right.
stuff like that. So I would still keep compression here and do very minimal things. But
Yeah, I have, like, wheelchair assist and stuff
Exactly.
set up for the airport, and I already told the kid that he was gonna, like, be my servant for the next few weeks.
perfect.
He wants an Xbox game, so he has to earn it anyways. Along with the healing thing, the
Yep.
next popular question
Okay.
was, how soon does somebody have to wait for sex?
Okay. I get that question all the time. Here's my answer. When I'm here with a wife and they ask me that question, I would say, what do you want me to say? 6 days, 6 weeks, 6 months, like, you just tell me what you want. But I tell most people at a week or 2, you actually can. I just say, take it easy, is really what I say. There's no reason not, but it's really, really take it easy. So yeah, by 2 weeks, you definitely should be able to.
It was just funny because it was, like, in my DMs from both, like, men and women.
Everybody
it was like,
asked, yep.
they're like, so you say you feel great. Does that mean you would be up for sex? And I'm like, it hadn't even crossed my mind right now. But, like,
It's a huge question to get. Oh, all surgeries actually.
Right.
So, but yeah, that's why for me, I just tell people.
I think the favorite way it was asked was, like, how soon do you want to show that off? And I'm like, well, right now it's still scary. It's very, like, sunset, like, with the bruising. But yeah, no, I mean, the response for this surgery has been, like, incredible. Like, every post has been, like, I mean, not a negative, 1 or 2 creepy guys, of course. Like, but
You're actually, you'll see this, there's always like the tipping point. There's always a point when we're treating people with lipedema, especially when, I take care of people, it's really, really bad. That you get to a point when you're like, all right, you're not past lipedema, but you're on the other side of it. This for you is going to be the other side of it. This is for you is going to be like, I'm happy with what I did. It's the best thing, hopefully the best thing I ever did, and you would do it again in a heartbeat. And so that's when you get to a point where it's like, listen, there's always negative people and this and that, but this is something that, I mean, you needed to. I'm just telling you, you needed to do this. Like, even if it wasn't for lipedema, I do large tummy tucks for people because it's like, it just frees you up. You can start exercising more. You don't have to wear things. It really, really is a game changer.
Well, like, even my compression for my legs wasn't hitting the top of my thighs
Never does.
because
Yep.
that stomach was holding it out.
Exactly.
And so, like, I think even just that will help keep, like, you know, my thighs and stuff compressed better, and just that fit will just be so much easier.
Yeah, that's part of the reason I do the stomach now at an earlier stage. I used to wait till the end. Now I do it earlier because that's exactly it. This sitting here, if I make your legs as thin and I take everything out.
Oh, I know, I can feel bone in my legs.
Yeah, so I take everything out. So if I'm doing that and you can't get up here, at some point it's not really helping. So that's
Right.
why earlier on, and then you're able to, that's why every stage gets better and better and better. So.
Yeah, and it is, or has been, the best decision. I told somebody yesterday or this morning, like, I would do it all again, even with getting sick last surgery and feeling miserable. Like, I would not change up a thing. Like, it has been the best decision, and I can't wait to, like, see what all we can tackle this year, because, like I said, I want to go into my 40s with as much of it gone. So we got to, like, you know.
You're a lot further ahead than you realize. So you're coming to the end. I'll tell you that. You're closer to the end than you were in the beginning.
That's crazy to think.
You're really getting there. So.
Yeah, I mean, and we have till December because my birthday is 4 days before Christmas, so we've got a while. But that's the other thing. They're asking, like, how many more surgeries, and I said, I feel like it's kind of hard to say because some of it's not till you get in there and see how much you can take.
It's a little bit. So you and I were talking before, because I was able to really shrink these rolls down here.
Right.
I think our next surgery, instead of starting from the bottom up, I think we're going to start from the top down.
Okay.
And so I think we're going to take out these rolls because they've really shrunk in, which is great.
Yeah.
And I think starting on the saddlebags and the hips and see what we can do with the buttock shelf and everything. I think, we want to see what we can do. You know, you're about to do some lymph. There's a lot of other stuff, and so we want to see what you have in there and what we're dealing with. And then you may take us a couple times to get stuff down. But I think that's going to become your game changer also. I mean, this was the big one, but once we start bringing this down, people have a lot of pain here, sitting for long periods of time, and so as we start doing that, I think you're going to do great. So. I mean, I can't tell you if it's 3 surgeries left. I honestly don't know. I mean, the arms we got to do as a surgery also.
Yeah.
It's really going to depend on this.
Sleeves drive me insane.
Yeah, we're going to get to that. It's really going to depend on how. If this makes it easy for us, then we know the legs, arms, and you might be done then. So, yeah.
Like, that's unreal to me.
Yeah.
Yeah, like I say, well, the back of my legs need done still. And the back and, like, the butt shelf. And I said, there's probably enough in the butt shelf for a surgery.
Oh yeah, there is. That's what I'm saying. So that's why I want to see what we can get out. If we can get it all out, like it's really fun. It's really gonna be great.
Yeah, with the butt shelf, like, it's really tender to touch, and sleeping is difficult.
Yep.
Like, because it hits the bed, but then the arch of my back does it. So, like, I always have, like, 1,000 pillows. So it'll be nice to, like.
Like I said, you have you hold it all here, and as we start tackling this and getting it out, like, we're doing it the right way. I'm glad we started there, worked our way up. Now, as we start doing this, like, it's literally, you're gonna be a totally new person. It's gonna be great.
I am not as clumsy. Like, my legs as a child were bruised all the time because I fell, like, nonstop.
Yeah.
But, like, my ex used to joke that I didn't walk in a straight line. And I was like, the hips have their own gravitational force. Like, I can't help it. Like, because, like, I would start out straight, but, like, it would just sway and I would, like, be.
Yeah.
But I've not fallen since the first surgery.
Yeah.
And that's insane to me because, like, I would fall all the time.
When we take everything out and you reduce the inflammation that's there, as things are healing, it actually makes things stronger too. So you have a little more strength, a little more control also over things, and so when that happens, that's why people feel lighter. They feel like they can do more, they can walk more. It really does help when you have all that there. And so you're gonna really, it's really gonna help you with this. It's gonna be great. So
Yeah, I can't wait.
what other questions did anybody else have?
I think that's kind of been, like, the most, like, the typical, like, you know, how much and how long and, you know, just.
I will say taking out 20, 25 pounds from people, like, it's a big thing, you know, and you look like, I mean, you're going to be a little tired next week and stuff, but I mean, you literally are doing this amazing. I mean, this is 5 days ago we just took this out.
I worked yesterday and today.
Yeah.
I mean,
I have that with more people than not. Everybody thinks they need like months off of stuff. I don't do that. I mean, we try to keep things as, we're soft when we do everything. We're not, but literally, I think here, I mean, this is right.
yeah,
Fine.
I know I've said it like 1,000 times, but like I completely mean it. Like you've given me like back a life, like one I didn't think like I would have a shot at.
Oh.
So I'm beyond grateful.
It's our pleasure. Everyone here, like you make us happy too when you do well. Honestly, you really do. It's actually why we do it. So, okay. Don't leave us. Stay.
I would stay in a heartbeat. I've got nothing really holding me in Pennsylvania. I mean, I gotta get the kid, but you know.
Oh, other than that, yeah.
Other than the 12-year-old who is probably enjoying being home mostly by himself.
Well, listen, have a safe trip. This is going to do great. We look forward to seeing you again because now you see we're getting there. And
Yeah.
Every time you're just going to it's just going to get you there. I'm so excited for you. I really am. And like I said, thank you for healing because you really worried me there. You really challenged me. So.
You know, I bruise. I do think too that the hyperbaric treatment.
Yes.
That was the other question. Like, what is it for? Is that for the helping the healing?
Yeah, it is. So I never used to just so hyperbaric has always been reserved for people like wound healing problems. If you're diabetic, is the way I explain the way it works, but it's really getting oxygen into areas that it's not easy to get to from swelling or, like I said, diabetes, things closed off. And so a few of my patients have done it on their own volition to start doing it the day or 2 days after surgery, and for some reason I'm taking out 5, 10, 20, taking out pounds and liters, and people just look better. They really do. So I went and had a treatment too, because I was like, I gotta see, I'm looking at possibly getting a chamber here to make it easy for people, because I do think there's something with it. There was data that came out about even anti-aging parts of it and stuff like that. So we've just seen great results with it. So it came out of nowhere. Like I said, people did it, and so now I'm starting to tell people as we do our thing, I'm like, we can recommend the place, try it, and most people. Did you?
I've done two.
2.
Yeah.
I'm gonna say, fully honest, I think one of the reasons you actually feel and look this good is because of that. I think it's
why my bruising is as light as it is.
It really helps. Like I never would have thought that it does that much, but it really does. So I really, really like it now. So.
I was so groggy for the first one that like I didn't even know what I was doing.
That's perfect.
I like got there and they're like, you have to climb in this tube. I'm like,
yeah.
How am I supposed to get back out? Because I had a drain on each hip, I had an IV in my hand, and my stomach was just sliced open. I'm like, I gotta climb back out of this thing? I
talked to the guy. They have a larger tube. I was in also because it's like, it can be claustrophobic, so
it was the best sleep I had.
Yeah, exactly. You're like, I'm just gonna, yep.
I was awake for the second one.
You get to watch TV though.
Yeah. But I mean, I really do think it's why my bruising is lighter.
I think
because
so, too.
like, I get purple and I stay purple.
Yeah.
And I'm a lot more yellow.
I'm telling you, I really, really think it is. And so, like I said, the goal is to have it here to make it easy for you. So you don't have to go someplace else. But I think we're going to start having this part of our normal regimen because I really, really like it. So.
Well, thank you.
My pleasure.